Food allergy is when the body inappropriately reacts to something that it should really just ignore because it's harmless, things like milk or egg or peanut, for example. We broadly talk about food allergy as two different sorts: the immediate or IgE-mediated type, where reactions happen very quickly, or the delayed non-IgE-mediated type, where reactions can be quite delayed even by a number of hours. FPIES is the most severe form of delayed type food allergy. It actually stands for food protein-induced enterocolitis syndrome. And it's a very nasty type of allergy that can cause very severe symptoms, particularly in the gastrointestinal tract of young children. The symptoms of FPIES are typically vomiting, intractable vomiting, that starts 2 to 6 hours after the food has been ingested. This is often accompanied by severe abdominal pain and also diarrhea, which can actually have blood or mucus in it as well. Typically, FPIES is caused by either milk or soy. But although these are the most recognised causes of FPIES, there's a whole range of other foods, many of which are generally regarded as quite hypoallergenic, things such as rice or chicken or corn, which are very rare causes of immediate type allergy, but are important causes of delayed type FPIES reactions. FPIES is a clinical diagnosis. There's no point doing allergy tests because this is not an immediate type allergy. So skin prick tests or blood tests, for example, to the food in question will be negative. With FPIES, the only way to be absolutely certain that you have the diagnosis is to do what's called a food challenge, which means giving the child the food to confirm that that reaction happens. Usually, however, this isn't necessary because a good clinical history will give a clear answer that FPIES is the problem. If you're worried that your child has had a reaction that might be FPIES, so for example if they've had something like milk or soy or other foods and then 2 to 4 hours later they've developed lots of vomiting, particularly if this has happened on more than one occasion, I'd recommend that you went to your GP, had a discussion with them about the possible diagnosis. NICE, who make national guidelines around how food allergy should be assessed and diagnosed, have got a parent's guide which is available from their website. Unlike immediate type allergies, where antihistamine or adrenaline will almost immediately stop the reaction, with delayed type allergies there aren't any treatments that will work quite so effectively. It's usually just a matter of supporting the child, ensuring that they're getting enough fluid, and if you're in any way concerned, calling your doctor, or if you're really worried, then calling 999 to ensure that they get the medical attention that they need. In most cases, we'd simply expect the reaction to settle on its own after the course of a few hours.